How come everyone's laughing so much? What's going on?
We're having a party.
This is, Beth, I don't think you should be a makeup artist. I hate to tell you this. Okay? That's not very good here.
I'm not going to do any changing
All right.
positions.
Hey, this is Sarah, and I'm 54 years old, and I'm one-day post-op from a full-face fat transfer, upper blepharoplasty, and a plasma resurfacing. I did great yesterday. I just had minimal pain, and I have a very low pain tolerance, and my doctors all my life, whenever I've had any kind of surgery or anything, have always said, oh, it can't hurt that bad. And I'd say, yes, it does, but this time I really have very minimal pain. I slept most of the day yesterday on and off, because of the anesthesia wearing off. And by the way, the anesthesia was unbelievable. I had no nausea. I felt great waking up. I had no after effects except being sleepy, which is normal. I have a little trouble sitting up because I sleep on my side normally, but they gave me the little neck pillow and in a chase lounge or a recliner or in bed with pillows. I slept really pretty well. My biggest complaint is the balm that you put on. It gets on your hair and it's kind of gooey, so I highly recommend you getting some sort of little headband to hold your hair back. Very easy to do. The other only thing that I would tell patients is if you're very nearsighted, like I am, like almost legally blind, get some sort of books on tape or something to entertain you, because I can't see that. I don't want to put my glasses on because I don't want to irritate the skin, and I couldn't watch TV. You can listen to radio and the music, whatnot. But anyway, get something to entertain you. I can read if I hold a book like 1 inch in front of my face, but that's not a whole lot of fun. So that's really my only complaint. Hey, it's post-op day 2, and as you can see, I'm a lot redder than I was yesterday, and I have some funny little white stripes, but Dr. Lamb said that was normal, so I'm not worried about that. And I have some little bruising under my eyes, but that'll go away, I'm sure. I scared some more people today. I had some friends come over to visit me, and they were a little surprised at how funny I looked. But it looks a lot worse than it feels. I really don't feel that bad. It feels tight, and when you wash your face, when it's drying, it feels real tight and dry and scaly. But as soon as you put that balm on, it feels fine. That balm is wonderful. I'm glad Dr. Lamb found that. It's a lot better than Vaseline. I think it's very soothing. I had a little itching, and so I took some Benadryl because I didn't want to scratch my face. But that's really the only problems I've had today. It was nice to be able to put some ice on, some ice packs on the eyes. That felt soothing as well. And that's about it. So see you tomorrow. Hey, this is post-op day 3. This is the roughest day I've had so far, but thank goodness for the video diaries on the internet that I've been able to watch. It looks like this is probably going to be the worst day. It looks like most people get better after this day, so that gives me hope. Hey, this is post-op day 4. I wish I'd taken the video earlier today because I looked really bad earlier this morning. I was really red and puffy and itchy. I had an appointment with Dr. Lamb, and he realized that I had an allergic reaction to the balm that I've been raving about, that I said felt so good, but apparently I had an allergic reaction to it, so it was making my face even redder and puffier than it was supposed to be. So he took me off that and told me to use hydrocortisone and Vaseline instead. And since I've been doing that today, my face is the swelling has gone down quite a bit and it's a lot less red, and I'm still a little itchy, but not too bad. So I'm getting ready to go take some Benadryl and go to bed, and hopefully tomorrow will be better. Hello again. It's post-op day 6, and I was kind of disappointed when I woke up this morning that I looked about the same as I did yesterday, because I thought since I was on the steroids I'd be a lot better, but I'm not. So Diane called the nurse. She's just been wonderful. She calls and checks on me, and she's very responsive. As soon as I call her, she calls me right back. And she's been talking to Dr. Lamb on his cell phone, even though he's out of the country. And they thought maybe that I might have a fungal infection on my face. So they gave me some antifungal medicine, so I'm taking that. And so we'll see in the morning. And tomorrow morning I'm going in for a checkup and to get my sutures removed, and then we'll check to see how my face is doing. And so we'll see tomorrow. That's it. Hey, it's been a week since my surgery, and I'm doing a lot better today. We don't know whether it was the steroids or the antifungals or whatever, but anyway, my face looks a lot better. It's still a little bit red, but it's better, and it doesn't hurt anymore at all. It's just itching. So they gave me some Ativan, which is an itching anti-anxiety medicine, which is great because it's counteracting the steroids, which make me kind of hyper, so I'm kind of in balance. They tried to take my camera away today, and I said, no, I'm still doing it. I'm getting addicted to this. I'm really kind of a shy person normally, and I never thought I'd want to do something like this. I was originally doing it just to help the other patients, but it's kind of fun, actually. So they took my stitches out today, and I think my eyelids look just wonderful, and I'm just feeling lots better today. One other thing that I've never heard anybody mention was the site where he takes the fat. He took it from my inner thighs, which, thank you very much, I needed that taken away. But you get quite a dramatic bruising effect, and it might scare some people, but it's, no big deal. I mean, that's just normal, so I just wanted to mention that in case anybody wasn't prepared for that, that's just normal. It'll go away. I have one funny story. I'm sure Dr. Lamb's going to have to edit this out because I'm just talking too much, but this was funny. He was talking about people's perception of you on one of his video companion series, and I went to the store last night, and I went to the grocery, and this man who is mentally, low IQ, he said, "Ma'am, what happened to your face?" really loud, and all the other people working in there were like shocked. They're like, "No, you can't say that to her." And I'm like, "It's okay, it's okay. I know I look really funny. I mean, everybody else looks at me, and they look away, but they don't say anything." And I said, "It's okay to say something." And I said, "Well, actually, I paid somebody to do this to me to make me look better." And he said, "I don't think it worked." So I'm going to go back next week after I'm all healed up and show him how beautiful I look. Okay. Good night. Hey, it's post-op day 10, and I'm about the same as yesterday. Maybe a little less itchy, a little less pink and swollen. The main thing, I'm tired of having Vaseline all over everything I own, so I'm hoping when I go see Dr. Lamb tomorrow that he'll tell me that I can switch to lotion. I guess he's going to take my video cam away from me, so this is my last appearance. Anyway, I enjoyed this so much, I'm going to actually get one so I can take it on vacations or play with it when I do stuff with my girlfriends. It's a lot of fun. And I have one last thing to say to all the nurses, and particularly Diane and Beth. This is how I'm feeling today.
I'm depressed, I get weak, my fist broke out, I'm nauseous, I'm constipated, my feet swell, my gums are bleeding, my sinuses are clogged, I got heartburn, I'm cranky, and I have gas.
Bye.